Number of measles cases in the United States just jumped to its highest level in 25 years.
Most infections are happening in communities where parents think vaccinations are unsafe. Thanks to social media, that misinformation is spreading. Time for Pat Kessler's reality check.
Measles were all but eradicated in the year 2000. The same year George Bush faced Al Gore for president.
It's time to have a fresh start.
Now, measles are making a comeback.
New York City is facing the largest measles outbreak in the country.
The Centers for Disease Control report a national surge this year. An Associated Press count now surpasses the 667 measles cases recorded in 2014, the highest year since eradication. The CDC reports overseas travelers are getting measles infections and bringing it home. It is so contagious. One person can affect 90% of the people around them who are not immune for days before and after a rash appears. So here's why Minnesota health officials are worried. Minnesota is one of 17 states that allows parents to opt out of vaccines for personal reasons. And those personal reasons often include a belief that vaccines are harmful, even though the available evidence says that's just not true. The CDC says vaccines do not cause autism. Infant immune systems are strong enough for vaccines. Natural immunity is important, but vaccinations are safer, and adverse reactions are rare. Measles spread in places where vaccination rates drop below 93%. In Minnesota, there are a lot of counties like that. 14 counties with rates below 90% where the risk of infection is higher. The CDC recommends vaccinating children against measles twice. The first dose when they're 12 to 15 months old, the second between ages 4 and 6. That's Reality Check.
Minnesota and Wisconsin did not have any known measles cases this year. The CDC says the disease can be especially dangerous for babies and children. Measles can lead to pneumonia, brain damage, and even death.